Howdy, guys. And thank you so much for joining us here at the Texas Public Policy Foundation for what promises to be an inspiring and an informative conversation about recent reforms in the Texas child welfare system. My name is Caroline Welton, and I have the great privilege of serving as campaign director for the Foundation's Center on Health and Families. In this capacity, I support our policy experts on both our child welfare and healthcare policies. Strong, healthy families make a strong, healthy Texas. This afternoon, we have the joy of being joined by several key leaders in child welfare reform. It is conversations such as the one soon to begin, which display that despite some divergence of opinion, we can together promote effective policy reform for the betterment of all Texans. With that, I would like to get things started by introducing to you our wonderful panelists. First off, we have Chair Frank, who chairs up the HHS committee in the House. Chair Frank is in his 6th term in the Texas House of Representatives. As chairman, he has fought for major reforms to the Department of Family and Protective Services, working to make the department more efficient, effective, and accountable, especially on the issue of child welfare. A longtime Wichita Falls resident, he and his wife, Alicia, live, work, and have raised their children in the community. The Franks have 6 sons, 2 daughters-in-law, and 2 beautiful granddaughters. An active and involved community leader, Chair Frank also owns 3 Wichita Falls-based manufacturing companies, is a graduate of Rider High School, a proud Aggie, and holds a degree in finance. Please welcome Chairman Frank. Second, we have the lovely Christine Kalpin, who is the Managing Director of Public Policy at Casey Family Programs. In her role, she supports the Foundation's efforts to inform and educate federal and state policymakers about the need for practice and funding strategies that support efforts to improve outcomes among children and families. She brings more than 25 years of public policy experience to her job, and prior to joining Casey Family Programs in 2011, she was an independent consultant on child welfare, child care, and family support programs for states and tribes. Prior to that, she worked for the U.S. Department of Health and Human Services, first as Associate Director of the Child Care Bureau, and then as Associate Commissioner for the Children's Bureau. She also served as lead congressional staffer on child welfare, child care, and family support programs for the U.S. House Committee on Ways and Means. She earned her BA in economics from Chatham University and has an MS in public policy analysis from the University of Rochester. Please welcome Ms. Christine. And last but not least, Andrew Brown, JD, is our very own Vice President of Policy at the Texas Public Policy Foundation. He has dedicated his career to serving vulnerable children and strengthening families through community-focused, liberty-minded solutions. As an attorney, he has represented children in the child welfare system, advocated for the rights of parents, and helped build families through domestic and international adoption. He earned his BA, magna cum laude, in political science from Baylor University and his JD from SMU. He is licensed to practice law in both Texas and Virginia, and his work on international adoption law, as well as other child welfare issues, has been published in leading legal journals and respected media outlets. Guys, thank you so much for joining us today.
And Caroline, I've been texting with Senator Kolkhorst. She is on her way. She was caught up doing the business of the people of Texas and will be with us momentarily.
We are, for now, left with only the House and not the Senate.
But don't say only the House. Don't say only the House.
The more passionate part of our representative
Thank you very
bodies.
much. Thank you very much. The timely side.
Indeed.
If I want Senator Kolkhorst to hear that, I will tell her myself.
Noted. Representative Frank, you have been a leading champion of reforms to CPS investigations and removals that have been enacted over the past legislative sessions. What results are we seeing from the implementations of these reforms?
Thanks. And if I could take a little liberty and just thank TPPF for being involved in this. One of the things I've said as conservatives, everybody says we want less government involvement, and then we don't get involved in any of the areas of public policy that actually get in our lives, like CPS, like public ed. And y'all have done a great job, Andrew leading the way, and even Brandon before that. And so thank y'all for doing it. So the changes that we've made, particularly as it relates to removals, have led to a pretty substantial decrease in the number of kids in our foster care system. 2.5 years ago, there were about 30,000 kids in foster care. Today, there are about 15,000 kids in foster care, and that's because the removals have decreased pretty dramatically. And importantly, it's decreased in the right areas, meaning if you're missing kids that would otherwise be harmed, that's bad, and something we took into a lot of consideration as we worked through. And there is Senator Colcourse. Well,
I don't know what to say.
Do
Just
the
working away at the Capitol. Lost track of time.
you can.
No, it's fine.
You want to finish or do the? So really, it is meant a lot less removals. What it has helped the agency do is focus on the kids that are most at risk, because you're still 100% of the kids. We only touched the definition of neglect. We did not touch the definition of abuse. So any kid there was an accusation of abuse, those kids are still being done the exact same way. We did try to make sure the agency was not arbitrarily removing children, and there was some of that. It's much more consistent across the state. There are some places literally in the state that remove it 10 times the average of other places in the state. And if you think about how serious it is to get removed, imagine if your laws for stealing were different in Taylor County as they are in El Paso. That is not the way we do it. We want to be very consistent in it. So I think by and large it has been very good for the state. It's allowed the agency to focus on the kids who are most needed. The number of caseworkers to kids is in a much better situation. And importantly, the number of child deaths has actually gone down, not up.
Oh, that's great.
Yeah. So.
Thank you. I want to take a moment to welcome Senator Colcourse joining us.
Hello. Does this work? Good afternoon. I just was in the Senate just working away, and we kind of looked at our clock and go, oh, we need to go. So here we are. Anyway, it's wonderful to be here.
Thank you so much. I'm going to give you a question, and then maybe Representative Frank can pitch in as well. In 2015, as most of us are aware, a federal court ruled against Texas in a lawsuit alleging that conditions in the Texas foster care system were so bad that they violated the fundamental rights of children in custody of the state. Since that time, the legislature has worked to reform the state's entire child welfare system. Can you, Senator, tell us about your involvement with these efforts and your assessment of the progress that has been made?
Well, thank you so much. Such an important issue that we're facing. And in 2015, I was new to the Senate and had come in as the chair of public health from the House side. So kind of jumping in Health and Human Services, was not the chairman. Senator Schwartner was there. He introduced, of course, some legislation, I think with you, Representative Frank, on community-based care and different things. I was on the committee and really studied that. I spent a lot of my time in the budget, and that's where I spend a ton of my time focusing. So I think some of the efforts that we made, Representative Frank, were you talking about 567 and also House Bill 730? I had, in 2019, authored a bill, Senate Bill, was that 781, about residential treatment centers. I think a lot of us, in a bipartisan manner, have been attacking, trying to say, what's the best way to do this? What Representative Frank, Chair Frank, was talking about was kind of right-sizing and focusing on the children that need our most help has been very significant through a number of bills. Also, if you look at the ratios of our caseworkers, certainly we're down to, I think, 10.1, where part of the court case was about that. So we're below. I think that they wanted us at 17-1. We're at 10.1-1. That's huge progress. If y'all remember when Hank Whitman was the commissioner for DFPS, one of the things that we did was we went and really tried to upgrade all of our personnel at CPS, huge increases in salaries, trying to get, people wanting to come in and serve in that role. And then, I will just say that community-based care is looking to reform the system. I think that we've made strides. We're in 5 areas now, regions, but we have a lot of work to do there. And then lastly, I want to compliment the leadership at DFPS right now and where they are. I think that Stephanie Muth is doing a really good job. She's brought in some veterans of state government, but she's also brought in some new faces. And you only are as good as the people at the top that set the tone. For those of you that work with Senate offices, you know that Senate offices take on different personalities. They usually take on the personality of their boss. And when Stephanie came to my office right when she was hired, it was in December of that year, I will just tell you that we laugh about this to this day. I looked her straight. She came to Brenham. And after we met for about an hour and a half, 2 hours, and again, it was almost the holidays. And I just looked at her straight in the eye and I said, I don't think you're up to the job. I don't think you can do it. And she said, I took that as a personal challenge to me. Listen, we still have our challenges, and she and I can get after each other pretty good. But I do think that we're reforming the system. It is not going to happen overnight. But there's been some great legislation that's been introduced that other states now are trying to do. And I want to give credit to Chair Frank. I do not have a better friend or partner in the Texas House in him. When we carry each other's bills, we really work. Sometimes, he doesn't even ask me to carry his bills. He goes off and finds Brian Hughes or somebody else, and they get all the credit, and I still like him, okay? But in general, he's a foster parent himself. I read an article recently, something that you said that just will stick with me forever, Chair Frank, and that is on your youngest son. In his first year that y'all had him, he was really troubled in school, and you'd have to be at the school a lot. And then when you the next year he was heading into kind of those tough years, middle school, and you expected that you were going to have to spend a lot of time, and you kind of waited for the phone call from the teacher, waited for the phone call from the principal or the counselor, and it didn't come, and it didn't come, and it didn't come. And you ask him, and his answer was, I know where I'm going to be tonight. It's a powerful, powerful statement. And so what Chair Frank has done is he's really attacked this from a viewpoint of being a parent. And so there's a number of things that have happened. The court case goes on, in short. Can we be better? Absolutely. Are we better than 2015? Absolutely. But it is not a perfect system, and we must work at this every day and trust those that we have employed, trust those that we're partnering with through CBC as we continue to learn and walk down that path. Long answer, but those are the things that I think we've been impactful on, and the budget funding has I think we've increased it 86%. In about less than a decade, so doubled the money, and now we see CWAP at where it is, less than 100. What were we averaging? 420 at one point. Wow.
If I could just add on to that, a lot of the changes were made before some of the bills that were passed were made before Senator Colcourse became chair. I know the House and Senate sometimes don't get along. We have been able to always get along on this issue because
they'll try to disrupt.
Oh, that's right. We probably shouldn't. We always argue about it.
Very out of style.
No, but so many of the bills that we pass, some of them can go into effect, but some of them only go into effect as the agency implements. And Senator Colcourse is a force of nature, and also has not only the policy strings but the money strings, and has a lot better ability, and I give her a tremendous amount of credit on getting the agency on board, even before Commissioner Muth. And I do think Commissioner Muth is doing a great job. Commissioner Muth actually follows the law. She actually implements the law with fidelity, and that's what she is supposed to do. And I think it's a lot of the reason. Last thing I'll say, because we really do want to hear from you guys as well, that the lawsuit, I think if there was benefit from it, it's because it got attention. That attention has been done, funding, and the results actually are very good with kids. The frustrating thing is now we are spending millions of dollars lining the pockets of lawyers instead of having that money go to kids, and it has long since been, basically there's no recognition from the judge, of the strength and the authority of the Fifth Circuit, which she seems to ignore, but also of the improvements that have been made. And the numbers do tell you that the kids are in much better shape. Are there still bad things that happen? Absolutely. You have 7 million kids in the state. You have 15,000 in foster care. There are going to be bad things, and we can always and should always strive to get better. But is the system much, much, much better and improving? Yes. And we are outperforming the vast majority of other states, which sometimes that's a low bar, but this is not that easy to do in the hardest situations that exist. So anyway.
That's great. Thank you. Andrew, Chair Frank spoke earlier about reforms reducing the number of children removed from their families. Can you tell us a little bit about how this shift in priorities came about and why this is important to the future of the Texas child welfare system?
Yeah, that's a great question. And what you're seeing is really a shift in culture in child welfare practice. So you look at the 80s and the 90s, even the early 2000s, very, very high removal. I would say almost a removal first mindset with the idea of we have to do whatever we can to protect child safety. And I think there was a understanding that we'll remove, we'll make sure everything's safe, and then we'll put them back, no harm, no foul. And there wasn't this necessary appreciation for this is not a neutral system. The act of removing a child is not a neutral act. The moment you separate a child from their family, you have harmed that child. You have caused that child trauma that they will carry with them for the rest of their lives. And over the years and over the decades, as the research into the impact of foster care on children from both a mental health and developmental perspective has come out, we've realized, oh, this really wasn't. This will be safe, and then, okay. We were actually causing harm. And so now the whole system and the practice has been rethinking, well, what do we do in these cases? How do we approach these very difficult decisions of, do we harm a child by removing them, or do we leave them in a place where potentially worse harm could come to them? And what it comes down to is essentially a balancing test. Is the harm we know we're going to cause this child less than the harm that has occurred or could occur if we don't do anything? And that's a really difficult place to be, especially from a policymaking perspective, because what you all as representatives and senators are trying to do is create laws that enable the frontline practitioners to make these very, very difficult decisions, sometimes on the fly. And it's a challenging place to be. Now, I think we're making amazing progress in Texas, and I think Texas has really been on the leading edge of recognizing this shift and developing shifts in policy to put that into practice, to the extent where Senator Colcourse mentioned other states are looking at what Texas has done. And crazily enough, like I get calls from folks in New York and they'll say, well, how is Texas doing all these really progressive things? And I kind of laugh and I say, because they're not really that progressive. They're common sense. They're looking at the facts and the law, and then, speaking as a conservative who comes at many of these issues from the fundamental constitutional rights of families, there is something that's fundamentally conservative about reforms, especially those protecting the integrity of the family against unnecessary government intervention. I think Representative Frank mentioned that earlier. We need more conservatives involved in this space, specifically because of that factor that's involved. So, the simple answer to your question is this is a major cultural shift that's happening in the way we think about child welfare, and shifting our focus toward prioritizing keeping families together whenever and wherever possible, unless things are so severe that we really do need to separate that child from their family.
That's wonderful. Thank you, Andrew. Christine, This shift toward prioritizing family preservation over removal has also been seen at the federal level. I know in 2018, the prior administration signed the Family First Prevention Services Act into law. Can you tell us some about what Family First is and how states have been implementing it, please?
Sure, thank you. And I'm just pleased to be with all of you here. So I'm really enjoying the conversation thus far. I think to build on what everyone has been talking about here is what Andrew outlined at the state level about the culture was really what the federal system was. And it was a system predominantly focused on a partnership at the state level that said, if you remove that child, we'll give you money. That's what we felt was the intervention that was most appropriate. And I think as we've learned over the years and from so many different folks that there are going to be, for safety reasons, very significant need for that type of engagement. And at the same time, with services and other type of interventions, we can mitigate risk, right? And knowing that families need to be at the core and the center of every effort to support their children, if we can think about a system that supports that, we'd be better off. Family First at the federal level said, okay, we agree. So states, we're going to continue to give you resources for foster care, and we're going to provide you resources in addition to that to support kids who are, who need help. Their families need help to allow those children to stay home, and we're going to partner with you on that. We're going to continue to recognize that the reasons that the system exists are, very significant in spaces of substance use and mental health for some very real issues, but that we're at a place where we have really effective programs that work, and that we can both help the family, mitigate the child, and keep everyone together, which is what we want. And it's a really exciting place in a partnership to be, right? It's left to the states to decide what this looks like. That's what was also exciting about it as well. It wasn't the federal government saying, here's the way to do it. It was saying, states, put a plan together, tell us what families this needs to look like. It very much leans into the opportunity to engage communities. It should be centered by families and children saying, here's our challenges, here's what we need. And I think that's exciting. And so we're beginning to see the vast majority of the states implement and move this forward, and I think we're exciting to see where it goes.
That's great. Thank you, Christine.
Can I, on the Families First, because I think it's got great motivations. I think we have been at the state, I think, hesitant, very skeptical, very afraid of partnering with the federal government. We've found most of those partnerships don't end up working very well and are very one-sided. And even though there is flexibility written into the law, that doesn't mean flexibility will still exist a year or two from now. So we have made a very tight. We have been very hesitant to use it for that reason. Really, it is a lack of trust. We have. One of the things that we, as state legislators, we're supposed to do is define who can use those. We made it a very narrow band of kids that the only services that we will use as a state are for kids that, were it not for this service, they would be removed. It's a very tight, because what we didn't want is basically programs going out and fishing for kids to remove. Basically going on a fishing expedition. We're from the government, we're here to help, we're here to take your kids. And so that's where it stands now, not saying, I don't know where it'll stand next. That's what we've done with it for now.
Yeah, that's great. You stole my question.
Oh, sorry.
I love it. I love it. This is a question for all of y'all. Building off what Chair Frank just said, since Federal First is a federal directive, Texas is limited in what it can do to address these challenges unilaterally. Are there any changes that y'all would like to see the next Congress make to Family First to give states more flexibility with implementation and maybe address some of these concerns that Chair Frank, for instance, is bringing up?
I want to echo what Chair Frank said to begin with, because one of the things that we have been hesitant on is that partnership, and can we trust it? That was such a bipartisan bill that passed under President Trump, and I think is at the center of it. We need to put families there again. I'm just going to tell y'all, if we can leave a child with a family, if we can shore up that family, that is one of the most important things we have to have. When you look at FFPSA, it's a mouthful. but it also comes with a few strings attached. I would like to have more freedom, and that would be potentially block granting some of those monies. When you look at Title 4ED or 4E in general, some block granting, every state is different. I've had some time where I had to travel this summer, and every state's just a little different. You can feel it when you land in the airport. You can feel it where you go, and to give us some flexibility. You look at, evidence-based, and that moniker that goes with that, and you'll know that I'm really trying to free that up and bring some ingenuity to that through Senate Bill 24. I'd like to see them trust the states in that regard, because it is a new space that we're entering into. And what Chair Frank talked about is you don't want a surveillance. You don't want a kind of a new. We've worked really hard at right-sizing DFPS and its roles. That's why Senate Bill 24 took PEI and moved it over to Health and Human Services so that we can focus on those very troubled children. So that's what I would think is flexibility. I would really like to see them. It's not that much money. It is new. Give us a chance. You can always pull back the rein. It's usually when you start it, you're not going to give flexibility. So I'd like flexibility. If we're failing at it, then mother may I.
Yeah, definitely agree and echo what Senator Kolkhorst and Chair Frank have already said. I think that danger with Family First is, does it create a new bureaucracy, yes. Right? What Texas has been doing on its own to right-size the system, to make sure that we are laser focused on the kids who really do need intervention, and not pull kids into the system who don't need to be there, has been groundbreaking. The risk that I fear with Family First, even though the principles behind it are fantastic, we do need to be doing more to preserve families. But that needs to occur at the community level, right? The most effective services for these families is at the community level. And having, prior to coming into policy, having worked some direct service, I've interacted with families who have been on that edge. And I can tell you from these conversations that they understand the system better than I think most of us on this stage do, because they've lived the experience with the system. And I remember talking to a mother, and I've told this story before in other venues, that was one of our first success stories with this startup that I was part of. And we asked her, okay, why did you come to us? The agencies have all of these different programs out there. Why did you come to us? And she looked at me like I was insane. And she said, why would I ask them for help? Those are the people who want to take my kids from me. And so whenever you are moving toward doing the right thing, which is keeping families together and providing resources to keep families together, you also have to realize that the families will not seek that help out if they think it's going to put them on the radar and potentially result in something much worse. And it's help plus surveillance. And that's what I think the danger with the Family First program is, and something that I think we need to be avoiding in Texas. I don't know that there's much that Congress can do to fix that problem. I think it's at the state level how we address these issues is really critical.
You mentioned culture change earlier, because when I view CPS, or at least most of CPS, it is a policing action. And I find it interesting that people want to give more authority to them while they want to defund police on one hand, because it is literally the parental death sentence.
I never thought of that.
I mean, but it is a parental death sentence. Because I think one of the things we've also done is, literally you have to now, the CPS worker has to read the parent their rights, because you're literally discussing whether or not you're going to remove that child. But when we make it, and yet a lot of people in CPS see it as a social work issue. But putting those two, I really feel like you need different uniforms for those things. Like you have the police uniform, and that's the I can remove your child if you have done something that reaches this level. And then if it's you're not going to go to the same person that can put you in jail and help. I think you really need to, from an agency standpoint, I'd like to bifurcate. That's why I loved having the PEI moved over to a different agency. It's like that's not the role of CPS in my opinion long term. It is a should you remove this child, should you not, and then we need to handle it extremely well professionally that whole time. And then the prevention, it needs to be done somewhere else.
Well, and to that point, I think that was the brilliance of Senate Bill 24 last session, was it recognized that what we know about the population that tends to come on the CPS radar is they're generally involved in other social safety net systems. So moving all of these family support services over into HHSC, where the majority of these families will probably already be going to get Medicaid, TANF, SNAP, these other benefits, remove some of that fear factor, right? Because HHSC is not DFPS, and they've already interacted with that agency before, and so it's kind of like a one-stop shop is how I kind of understand Senate Bill 24 is you go in and say, okay, I'm struggling with income, so I've got, the social safety net services, and also, I could use some parenting help. And you can kind of pick off the shelf as to what your family needs.
And what Andrew's saying is that, again, that I'm not sure I want to go until DFPS, who had great PEI programs. And guys, our PEI programs were mainly general revenue funded. So, I refer to as a finance person, general revenue is jet fuel. I mean, that is pure state money. There's no match. It's a lot. And so what I found was that the agency started to love that part, but that there's a hesitancy by some of those parents to say exactly what you're saying. Are these the same people, if I make a mistake, they can yank my child from me? They were separate and different staff, and they did wonderful. And some of those staff are going to move over to HHSC. But I will say that you're right about a one-stop shop. These are the people that are financially struggling. If your child is on Medicaid, you qualify in a strata that is below the norm of federal poverty level. We put that percentage out there. And how can we help you be better parents? Because those are the ones that are working two jobs. They're not always there. They have to drop their child off with somebody. Maybe they're not as engaged on the weekends. Maybe they're not, all those things. So it's going to take a long time for 24 to take root, and that's another thing. Chair Frank, all these bills that have been passed since you've been chair of Human Services, since I go back with Schwartner, but then took the reins in 2019. When we pass a bill, it just takes a long time, and I know there's a lot of staffers out here. And man, we go, oh yeah, got it to the finish line. I love when a staffer goes, my bill, like they have ownership because they've helped a senator or a state rep craft it, and I got my bill passed. That's where the work just begins, man. You've got to follow it, and you got to follow it with the agency, and really, it will take 4+ years to really see take hold. So I think 24 is going to take a while, and that FFPSA, we still just have a lot of work there. I'm not sure. I'd love to hear what you have to say about it.
Oh, yeah. I mean,
what would you change? Now that I'm the moderator, what would you change?
Well, I love getting out of DC, right? And I generally am used to being on a panel.
I love getting out of Boston.
Well, because I get a chance to, I sit in a room oftentimes and think about the idea of what we intend at the federal level, but then what we meant at the state, right? And I think, the one of the things I'm hearing too is, the states came to Congress, and the youth came and said, look, you could have helped my mom. That's what would have looked different. And so we had a lot of conversations about what does you could have helped my mom look like, right? And why are these families coming? And that's where substance use, that's where mental health came. But what we really, I think what we learned is, federal language that says, who would be eligible are those kids at imminent risk of foster care, was going to open a whole category of conversation about, well, what does it mean to be imminent risk, right? How would states define that? How would we make sure we're not bringing families into a system that don't need to be in a system? And we're learning, and these are the right questions to be asking, because that's exactly right. The CPS knock on the door is something that we should recognize with the highest level of intent of we don't do that unless we're absolutely warranted. And that's a whole culture fundamental shift, right? So there is a long way to go with Family First. I do believe there is a lot of opportunity within the existing law to think about, and states have been leaning into what we call community pathways, the idea of community partners as the entity that engages with families. What's the tension? we love data at the federal level, right? Like, we need data to reimburse you. We need data to know if our programs. So what does that create? That creates a record. That creates a plan. And that inherently creates a whole lot of surveillance and trust questions that I think we're still wrestling with. And so I think, I don't want to leave I think we're learning a lot about evidence-based programs, right? We spend a lot of time at the federal level believing the dollars were not being spent well. And so this idea of evidence-based, but we have a large way to grow, a long way to go in child protection to continue to grow programs that work for all of our communities and families too. And I think that's inherently been a challenge. So, those are just that's kind of where I'd start. But I think what's exciting is that you all are bringing to us at the state level, like, what are the struggles in implementation? And so how do we keep thinking about this, and how do we keep talking about it? And I will say there really is bipartisan leadership. Chair Kevin Brady at the time, when he led this, really worked alongside all the partners. Senator Cornyn in Texas has been a huge champion with the court and so many other issues. And so it's exciting to see them begin to get engaged and continue to have these conversations.
That's great. Thank you, Christine. Andrew, we are seeing fewer kids entering the foster care system, and early data shows that reforms enacted by the legislature are working to improve safety and create a system that's more laser-focused. Can you tell us a little bit about what this means for how the state provides foster care services moving forward?
Yeah, and I want to say that this is preliminary data. What I look to a lot of times is there's a federal child maltreatment report, and because it's federal data, it's always delayed by several years. The most recent one came out a few months ago, and this was really the first one where we had enough time between some of those major reforms that we've been talking about were implemented to see, okay, what's happening on the ground? How is this playing out in the data? And like Chair Frank mentioned at the start of the panel today, we're seeing entries into foster care going down in Texas. Simultaneously, you're starting to see a little bit of a decrease in child deaths as a result of abuse or neglect, according to that federal report. It's good. First report, always take it with a grain of salt, but it does tell us things look to be trending in the right direction. And so we want to keep that momentum up. We want to make sure that we're now aware of what are we doing right and continue to do the right things, make sure we identify where we might be starting to lose the path a little ways and course correct. But in terms of what we're seeing, I think it's a very promising place that we're going to. Now, what does that mean? When you look at the kids who are now coming into the system as opposed to those who had previously been coming into the system, it's more and more acute needs. So these are higher needs kids that have more issues that they need help overcoming related to their trauma background and experience. These are more challenging cases for the foster parents. And so we have to start rethinking, what does the ideal quote unquote foster parent look like? And how do we sell and recruit becoming a foster parent to the public? Because, the thing that we always have to remember about this system is it is so reliant on the average citizen, the average Texan saying, I want to volunteer my time. I want to open up my home to bring in a child and to provide care for them and provide a safe, supporting, loving environment for them for the duration of their time in this system. And we need to be very, very honest with those Texans. And I think we've had a mixed history of being honest with the foster parents that we recruit and making sure that they have a really clear understanding of what this means and what's going to be expected of them and what's going to happen when that child enters their home. And as you're seeing, like I said, more intensive care needs for the population in foster care, that changes both the type of the foster family that we need to recruit and how we train them up, how we compensate them, and how we support them.
I'm going to say something here. True.
Please.
Okay. The intensity, the acuity of mental health and other issues that we're seeing with some children are really challenging. If you look at CWAP, children without placement, 48% are wrapper children. That means that their parents have relinquished. They just show up and say, I can't handle my child anymore. And I think that the challenges, and something that Chair Frank and I are working on, is the mental health side. I didn't say this when you said, how do you think you're doing with the court case and different things? Because the quality of those placements, you can't just take a child who has maybe been trafficked and plop them into a home. You have to really work with them, and that's with counseling and different skills. And I'm one that says you just can't drug a child either, and say, well, here, take this pill, you're going to feel better. No. We really have to work in deprogramming them and letting them nurture them and bring them back. And so you look at our residential treatment centers and some of what happened in the court case. Long before I was chairman, I knew we had problems with our RTCs, and like Senate Bill 781, it was kind of a simple thing that was building off of nursing homes that just said, hey, you have 3 violations, strike 3, you're out. And I literally had people come say, we will not have an RTC left in the state of Texas. And I go, we're that bad. And so we had to really work at it. And you look at Family First and the QRTP, I always get those quality residential treatment centers, QRTC, and those programs. Guys, we don't have anybody in Texas that qualifies. I think now DFPS tells me we have 2, Chair Frank? Maybe we'll get, and so when you really look at that, and Andrew, when you say we haven't told foster parents, well, this is what you're getting into, we have to focus on those, those children with those high acuity rates and what we're doing, because some of the percentages and some of the reports I'm looking at is after they age out of the foster system, they're some of the people we see on the street out here. And so how effective are we? And that's what I mean about going back to right-sizing CPS is, that when I think we've made some of the bills, most of them have been House bills, and they've come out with bipartisan votes and bipartisan co-authors, is now we can focus the system on those children and how we help them get better. And a lot of that can be done through community-based care and making sure that we do that the right way as we roll it out. So I'm a little bit excited about it, but I'm also anxious.
That's great. As we move into closing questions, I want to hear a little bit from Christine about what community-based care can be doing to address these more acute cases that we're seeing, as we've discussed.
I think the community-based care model is the heart of what we believe we should be doing. We believe communities have the responses for what we are engaging about. I think what you all have really uplifted, though, that's so critical is child protection can't be everything. And the child protection workers right now are expected to be mental health, substance use, domestic violence, counselors, right? There has to be a much more effective engagement, partnership, or expectation of our systems like behavioral health to be a front door system for these families, so we don't engage with the family and child protection, right? Like the reason parents largely are relinquishing custody is an absence of services on their behalf, right? The small number of, what have we done to really try to mitigate and support them, and what can we be doing to keep that family together is the opportunity. So, and I look at Texas as community by community is how we're going to figure this out. You can't come up with one solution that'll work for everyone, right? Like you have to really understand the needs and figure out where your gaps are. But the community-based care model is going to allow them at the community level to really think about that and build it from the ground up.
That's great. Thank you.
As long as at DFPS we don't say, this is what you have to do. And that's one of the challenges right now is that this is what you have to do. Oh yeah, you can do it in the community, but no, that you have to do it just like we were doing it. You
operated exactly like a state agency.
Right. And I think
but do it with an extra layer.
Because we're rolling out, like a little more, we're pushing
49.9%. are in community-based care now.
Right.
Right there.
But the challenge, and I think that Chair Frank, and I think that there's some senators reaching out to me, and you might have some House members, is it can't be, oh yeah, we're CBC now, but you're going to do it just like the state agency did it. And El Paso is very different than, let's just take Aransas County. And so we do need to give them that flexibility. And I would say, with Family First, look, I'm lobbying. Let's have some more flexibility there, too, because it would really help us.
Senator Kolkhorst and Chair Frank, as current chairs of the committees that oversee the Texas child welfare system, which issues are y'all looking at prioritizing during the upcoming 89th legislature?
I'll let you go. You're the veteran here.
It really is continuing improvement. One of the things I tell people all the time, don't say CPS is broken, because it works great in some places, but we ought to always be trying to get better, and that's nothing different next session. The continued rollout of CBC, we just got to 50% after 8 years, thanks in large part to Senator Kolkhorst finally saying,
y'all, I would
having
go
the
into
money
the
side
Senate
going, we are going to
Finance
do it.
meeting, and we would see the same thing every time. And I would go,
I passed the bill, but I don't control the money. And
like,
so
it
she's
was like, didn't that look like that 4 years ago? And it did. I'd be
yeah.
like, no, we're moving.
Oh, yeah.
We're moving.
No, it's that has been a great tag team. I think continuing to roll it out and roll it out well. We actually had a big study to try to decrease the regulations in the CPS world. If any of y'all have ever been a foster parent, when you're counting socks late at night, it's not the best thing for your quarterly report. Like this, there's so many silly things in either qualifying to be a foster parent or to be a foster parent that are just completely unnecessary. I have tried different ways to do it. Finally, we paid for a study, and the agency will have to write down any of the recommendations that they don't want to do. They'll have to say why they don't think it needs to be done. Basically, the things that we want to keep there are things that are child welfare related. Anything that was just put in place because somebody thought it was a great idea at some point, those will be removed. There's a bunch of others, but it really is just pressing on.
For me, on the budget side, you look at the T3C, which is the rate modernization. We haven't really talked about that. That was $233 million, I think it was, in this biennium. That number grows largely and exponentially. Senator West and I have always been very interested in kinship placements. Those rates have gone up. I think a challenge coming into the next session as we look at rate modernization taking hold, making sure that those dollars don't become a flashing beacon for private equity or for Wall Street. I've been around that building a long time. And I think Sylvester Turner one time said, "Follow the dollar." I mean, he said it on the front mic. I loved it. He made it rhyme. And that I think is a challenge. We look at nursing facilities sometimes, and we don't see the care really going to the resident. It gets siphoned off and sent somewhere else. So I'm going to really kind of dive into those weeds. And then the last thing is the behavioral health element. When you really look at our MCOs and what their role is, you look at the LMHAs and what their role is, and then you wake up one day and you just say to CPS, "Hey, this child's got mental health problems, you need to fix it." That shouldn't be how a child falls into CPS, and it shouldn't be solely CPS or DFPS's issue. We are paying billions of dollars. The single largest contract, I believe, that the state renders is the Medicaid MCO contract, which all of you staffers know is going on right now, and I won't comment any more about that. But when I start to say, now, what do you do for mental health for our children in CPS? I don't know. I mean, like, everybody's like this. I mean, everybody starts like looking around. So it's been a great discovery. We're gonna look on those issues, build off, partner with the House. The House comes up with some great ideas. I've got some senators out there that on the committee that are really interested in this issue, and we have to continue to get better. The court case, obviously we have almost fully funded almost every need at every turn. Again, the ratio 17-1, we're 10.1. The hundreds of millions of dollars that we're facing with court monitors, I think we're getting better. I'd love to see us get a little credit for that.
Thank you. And finally, Andrew, what are some specific reforms that TPPF will be advancing during the upcoming legislature to strengthen protections for parental rights and promote family integrity?
Yeah, very quickly, because I know we're tight on time. Things that I'm really excited about is, looking at the effort that we put into prevent removals and to reunite children, and being more active about the work that's done to keep families together. I think there's things that we can do in statute to raise those standards. Also looking at the grounds for terminating parental rights. It's the civil death penalty. It's the state saying you are no longer your child's parent legally, and that relationship is over. We've got 22 grounds under which the court can terminate your parental rights. We need to take a look at those because they've kind of built up over the years. Some of them make sense. You read the ground, and you say, okay, yeah, a parent who does that, we probably need to go ahead and terminate. But some of them are so much more subjective. If you're a parent and you're working your services, but you don't do quite a good enough job in the eyes of CPS, you could potentially lose your parental rights for that. And we've had Supreme Court cases here in this state dealing with those very issues around the vagueness and the subjectivity around some of those grounds, which for me, that's a constitutional issue, right? That's taking away one of the most fundamental rights a person has without real clarity on, well, what's the wrong that crosses that threshold. So we'll be taking a real close look at that. We'll have research coming out on both of those areas. And then finally, the area that I'm particularly excited about is really broadening our scope outside of only foster care and CPS issues within this campaign, and starting to look at how do we make Texas the single best place to get married and raise a family, right? Promoting marriage and family formation, because we know that if you have strong and healthy families, you have a strong and healthy Texas. And I think that really is the wellspring, the source of addressing so many of the other big issues that we have, is making sure that the family unit is strong and healthy in the state of Texas. And I'm really excited to tackle those issues.
Awesome. Thank you, Andrew. We have about 10 minutes for y'all to ask any questions of our panelists. We do have microphones going down. The briefer your question, the more we can get through.
I have an important one. Are there any more Chick-fil-A lunches out there?
So I saved one for you.
Oh, man. Awesome.
The most important question.
I'm starving.
We have a brand at TPPF, and it is intricately linked with Chick-fil-A.
I love it. I love it.
Maybe they could sponsor us.
I do. Oh.
Yeah, can we ask her first and we'll come to you, ma'am? Oh, I'm so sorry. No problem.
First, thank all of you. I've become passionate after 2 of my grandkids were impacted a few years ago by the system, not on removal, but on services. Wow. But I guess in particular, you touched on this, Andrew. Your House Bill 567, when the session before it passed, you had House Bill 3331, I think. You had that section in there, and I asked about this when you filed House Bill 567, about considering the trauma that you're causing the child by removing for reasons that because a lot of times, especially under termination, that's a biggie. You're causing more trauma, especially when these children are younger, and you're removing all of them because of an issue with discipline on the older child. You're causing trauma to those, and you want to answer, but I'm hoping that y'all go there this session.
Okay. And really, to restate it, in the prior year, because it took 2 sessions to get that 567 passed, the bill had that we would consider that the CPS worker had to consider the trauma of removal when they waited. Just exactly what Andrew was talking about. You should consider that. And that was in the bill. We got a lot of good stuff that got to stay in 567. That didn't. I may go back and try to get that back in there this year. We put about 12 different groups in the room. Certainly Andrew was there. We had people from all different parts of the political spectrum trying to figure out exactly how much we could get in there. There was a lot of concern that, we wouldn't be removing anybody if we left that in there. I firmly believe every single caseworker in the state should have to say, this is going to factually create trauma. Is it worth it are they at that much risk? Yeah. So I don't know what I can say other than that we negotiated. We got a lot of good stuff in there. That one I just couldn't get to stay in. Right. And I agree. And that is one of the reasons. I mean, one of the reasons that we really tightened up the language and said what you can't remove them for, and added the different language, was to try to get it consistent, because it is absolutely ridiculous to have 10 times the removal in Taylor County that you have in El Paso County. I don't know if that's a county. 10 times. No, brag on El Paso because they're way below the state average, because usually they take care of their own, right? So they're below the state average, but you shouldn't have that.
I'm Hillary Hickland, a nominee for House District 55, and thank you. I met with a residential care facility for youth, and it's a private entity, but they also have residential facilities in other states, and they talked about two of the issues that make it almost unsustainable to be in Texas as one of those, as the need for acute residential care increases. The two issues were there being so many restrictions, and they're constantly having to go through investigations over, if a
heightened monitoring.
Yes,
things like that.
and that there's almost an adversarial relationship with the oversight, and that it was just very difficult to work through. And then secondly, Texas, compared to other states, that the funding for these facilities is not comparable to other places, making it very, very difficult. And I was really impressed with this facility. They have great outcomes. So considering those issues and that there is a rising need for those acute cases, is there anything that we're doing here in the state to make that easier?
Yeah. So what you referred to was heightened monitoring, or the court monitors, and it's a part of the lawsuit. And we, you go talk to any residential treatment center, and they're all very fearful. Some of them relinquish, or they relinquish their license. I mean, it's been a lot. It really has. So that's one thing, and we continue to work. And I read an article the other day that Texas fights the court system. Well, no, we're trying to figure out how to move forward and making sure that we can, better the system and get, like I said, a partnership better. And I think that we could eventually get out of this case if things didn't keep getting added to it. Right. Did I say that properly? Mm-hmm. Okay. Yeah. Then the other thing is, I think that rate modernization is going to help with the money side.
I would just speak to the heightened monitoring. Yeah, the court case, it is kind of frustrating. And Judge Jack, I think, I brag on the fact that, hey, it got a lot of focus on it, and there has been a lot of attention. But this is literally the only case she has. This is her reason to exist. And there is no understanding of the improvements that have been made. But there's so much monitoring, particularly the group homes, that literally they can't operate. People are just saying, we're done, we're out. And so we continue to have less and less beds. And then she gets mad that we don't have a place for the high acuity kids. And I'm like, it's really like the arsonist complaining that there's a fire. Right. It's not, and I do think the agency does have a direct plan. We've hired outside counsel now to try to get out of it. There's some things that I think are happening that I think will be positive in the near future on the court.
But not out of it
case.
To say we're so great. It's like I think it's to be able to move forward, right. Almost, right?
Yep.
Is our thoughts. So yes, I agree, and we're trying to help.
Guys, we are out of time for questions. Can you join me in giving our panelists a round of applause?